The Ashanti Regional Health Directorate has confirmed 5 new cases of COVID-19 out of 204 that it sampled at the Komfanoji Teaching Hospital. The Directorate also says persons in areas identified as hotspots in the region will undergo voluntary testing for COVID-19. This is part of measures that the Regional Health Directorate is taking to curtail a spread of a spike in the disease outbreak there. At a media briefing this morning, the Health Director of the Ghana Health Service, Dr. Emmanuel Tinkram, revealed that new cases have been recorded there.
Under the mass screening, we have certain hotspots in the region. The hotspots are areas where we've isolated cases. And then all the households around where we've isolated cases will go into what we call voluntary testing. All of them will be tested, but this one is voluntary. And then those who are positive will be enrolled, as we said, and then followed up. We are also considering testing high-risk groups. The high-risk groups are the frontline workers, drivers, taxi drivers, Uber drivers, market women, and those who are selling the market. These are the people who usually come into contact with a lot of people. And then they will also be enrolled into what we call the voluntary testing. So they will first be, it's voluntary, but they will be tested, and then those who are positive will be enrolled. And then the routine surveillance will continue. Under the routine surveillance, if you have any signs and symptoms, fever, cough, difficulty in breathing, what you need to do is that you call the number 112. You don't have to come to the hospital. We will come to where you live, and then the medical team will interact with you, and then if it's necessary, we will do the testing, and they will follow you up. The most important is that the rules and regulations still applies. The lockdown, we all admitted, was difficult, especially for the poor and then the vulnerable. So it's out of very good wisdom that the president decided that he's going to unlock the lockdown. But as he said, that is not the reason why we should assume that the fight is over. The fight is not over at all. This is the time that we need to strengthen the fight and then make sure that we all adhere by the rules and the regulations. And when we do that, it's likely that we may contain the infection. So number one is that social distancing is the key. And anytime you come closer to any person, less than 2 meters, then you know that you are in trouble. So if you don't have anything to do at all, please make sure that you stay at home. Because anytime you step out of your house, then it means that you are exposing yourself to what? To risk. The proportion of asymptomatic carriers are many. And it's not likely that you will identify them because they themselves don't know that they are sick because they are not showing any signs and symptoms. The wearing of face masks is so important because, as we all know, the disease is spread by droplet infection. So anytime you wear face mask, it protects you better because it's likely that at least you will be better protected than not wearing face mask at all. We have several types of face masks. Even handkerchief that is appropriately made is a face mask. You cannot wear it. You don't need to put a lot of burden on what we are already using in the hospitals. But if you can also manufacture your own face mask, I think it will be appropriate. But make sure that anytime you are stepping out of your home, you should put on face mask to protect you. A lot of countries have done that, and they've come out with a lot of success stories. I believe that we also have to adhere to this.